good to have you with us again. Would you comment on what Chuck just said? Would you comment on what Chuck just said, that the White House has quietly been saying that they could live with the principles of a co-op because it really doesn't hurt the principles of health care reform?
The problem with that is it's been tried. Blue Cross Blue Shield started out as sort of a co-op, a nonprofit with lay people on the boards, subscribers on the boards. Blue Cross Blue Shield, most of Blue Cross is now taken over by the private sector. Their health insurance behavior is no better than anybody else's, and they don't have a public reason for existence anymore. They're private health insurance companies. It doesn't work.
And Howard, if you talk to the people who run co-ops, they say, of course it can work. But then you talk to other people who say, no, you can't be scaled. These are great little local, regional ideas, but it just isn't going to work on a national basis.
There are a couple of good co-ops. The best one is in Washington State, and that works. But it works as a delivery system in that particular case, but it doesn't have much market impact. You've got to be really big to have market impact. The problem with the co-op is that what you basically end up with is a bill that dumps $60 billion a year, which is the price of this bill, into the private health insurance industry, which has behaved abominably in the last 15 years towards both patients and primary care
Howard,
physicians.
I heard you say that this morning, but explain that to me. How does allowing co-ops put $60 billion right back in the hands of the private insurance companies?
Because the co-ops are going to be private insurance companies. We already have a nonprofit health insurance companies and for-profit health insurance companies. In many ways, they act the same. And the nonprofit health insurance companies are under huge pressure by the for-profits, which use their enormous economic muscle to not only push them out of the way, but also buy them up. Over the last 15 or 20 years, companies like Anthem have bought up huge numbers of Blue Cross nonprofits and turned them into for-profits. We did not allow that here, and we're much the better off for it. But when it happens, it's a disaster. These co-ops are going to be too small to play in this marketplace with these huge behemoth health insurance companies that push patients around, doctors around, and nonprofits around.
If you look at the language for selling something like this, and the word public option, I would say, is almost a dirty word right now. Do you think there's a way to
No, it's not. Don't be silly. Of course not.
Well, yes, it is. I mean, if you look at people on the right, of course they're making public option sound like it's a dirty word.
The people on the right are totally out of touch with what's going on. This is propaganda they're putting up. A public option is Medicare, for God's sakes.
All right, so let's assume it's not a dirty word, but it's a politically charged word.
Let's make that assumption. That's a good assumption.
So let's say it's a politically charged word. All right. Well, if we took public option and retooled it somewhat, why not make the case to the American public that we will allow people below the age of 65 to buy into Medicare, even if there's some trimming has to be done out of that budget too?
That's all I want. If you had allowed people to buy into Medicare who are below 65 years old, that's a public option, and that's what we need.
So who's going to send that message forward then and demystify all of this?
Well, that was actually one of the programs I ran for president on in 2004. 55-year-olds could buy into Medicare or over, that young people 25 or under could get into Medicaid, which we allowed in this state, and we have universal health care coverage for everybody under 18. Everybody else is in the employer-based system. I think Obama's plan is a better plan than the one I had because it's more comprehensive, but if it doesn't have a public option, then it's really not health care reform.
Governor Howard Dean, as always, thank you, Howard. Appreciate it.
Nance, thanks for having me on.
You bet.